Bonjour à tous, bienvenue à cette conférence de presse. Le Premier ministre du Québec, M. François Legault, est accompagné du ministre de la Santé et des Services sociaux, M. Dubé, et du directeur national de santé publique, Dr Horacio Arrude. Donc, je vais laisser la parole au Premier ministre.
Hello, everybody. First of all, good news. We have to take good news when we have some. So the first piece of good news is vaccination started yesterday. So things are going well, and it's a step that is truly important. We can see the light at the end of the tunnel, even if it's a little bit far away. We must all understand that before we've vaccinated most Quebecers, it's going to take several months, and we will see how the deliveries of the vaccine will unfold, but we are ready, and up until now, everything is going well. The other good news is that even if the numbers are high, when we compare ourselves to the U.S., when we compare ourselves with most countries in Europe, we can see that in the second wave, if we look at the numbers since the 1st of September, we are doing better with just about every indicator than elsewhere in the world. So that is encouraging. And mainly, I want to say congratulations to Quebecers. In Quebec, there were fewer contacts, so Quebecers have respected the measures, but it still remains high. And it remains high even in Ontario, where they were spared since the beginning of the pandemic. Yesterday, they beat a record, 2,275 new cases. Yesterday, we had 1,741 new cases. But where it really hurts is the number of hospitalizations. Yesterday, we had a net increase of 69 hospitalizations. We are now at 959 people. So 959 beds in our hospitals are occupied by COVID patients. So beds that cannot be used for other things in hospitals. And that is very difficult. It puts a lot of pressure on hospitals. The other place where it's difficult as well is in the schools. Yesterday, in one day, we had to close 181 classrooms. So now we are at 1,503 classrooms that are closed. That means that there's around 4.5% of children who unfortunately cannot go to school. So the holidays are happening at the right time. So what that means when we look at the numbers is even if we're doing better than other jurisdictions, the level, the spread of the virus is still quite strong in Quebec. And it's difficult in many hospitals. And in addition to this, we've got 7,411 healthcare workers who are absent for all sorts of reasons. So it's very difficult in the hospitals. So we had some big discussions, the Minister of Health, Public Health. We tried to consult as many people as possible to look at what's happening elsewhere. And today we are presenting to you a new plan, which we could call the holiday break until the 11th of January. What we are proposing is to stretch out the holiday period until the 11th of January. So the new measures that we are announcing today, well, first of all, office employees, we are asking all people who work in offices to work from home. So that will become mandatory as of Thursday. So as of the 17th of December until the 11th of January, except in very exceptional cases where the presence in the office is necessary to provide services. And that is applicable to the public sector and the private sector. So offices, teleworking only. I'm going to come back to the schools. What we had announced was that the high schools would be closed from the 17th of December to the 11th of January. We are not changing anything there. When it comes to elementary schools, we had announced a closure from the 17th of December to the 4th of January, we are adding 1 week. So that means that all schools, elementary schools, will be closed from the 17th of December to the 11th of January. But when there should be the days there should be classes, there will be homework and some teaching, there will be remote learning. Now, the daycare centers remain open. However, I'm calling on everybody here. I am asking all parents who are able to keep their children at home from the 17th of December to the 11th of January to do so. Now, for daycares in school settings, they will be available only for priority service sectors. And all the information that I'm giving you will be on the website tomorrow. So what our priority service is, you will have all that information. The other thing that public health is asking is a few zones that are in yellow will now go to orange, and the zones that are in orange will go to red from the 17th of December to the 11th of January. So for that same period of time, that means, amongst others, North Shore, Abitibi, we will go to orange, Gaspésie will go to red. So it's going to have an impact on gatherings and on restaurants. However, for that period of time, the 17th of December to the 11th of January, we are announcing some easing in the restrictions. So outdoor activities, there's a lot of people who will be on vacation. A lot of children will be on vacation from the 17th of December to the 11th of January. So public health will accept that activities such as hockey, that it can be practiced, but with a maximum of 8 people. Same thing for ski classes. So there can be ski classes with a maximum of 8 participants, plus the monitor, the trainer. We will also make sure that the outdoor sites, like the botanical gardens and the parks, will be open to make sure that people who want to go snowshoeing or to do some cross-country skiing, you know, it's a good thing to go outside and to get some fresh air. It's much less dangerous. There's less spread of the virus outside than there is indoors. However, it's important if you go do some cross-country skiing or some snowshoeing, you've got to stay 2 meters away from other people. However, what will be prohibited is gatherings in backyards behind homes. That is not allowed. The idea to allow these activities, these outdoor activities, is that people will move. So we don't want to see any static gatherings. If people are skiing or playing hockey or skiing, it's okay. And even if they go for a walk, but you must respect the 2-meter distance. Another easing of measures that we're announcing today is for people living alone. Currently, people who live alone can have 1 visitor at a time. What we will allow is that people who are alone can go into the bubble of another family. And that means, technically, a mother or grandmother who wants to go visit one of her children to spend the evening or a couple of nights, that will be possible for the people who live alone to go into one, but only one family bubble for that period of time between the 17th of December and the 11th of January. It's important to mention this. Public health is saying that if we want to limit the risks, it must be only in one family bubble. And finally, shops. After discussions, what we are proposing is that all non-essential shops will be closed as of the 25th of December until the 11th of January. So we're making an exception for shops that are not essential. That means shops except for grocery stores, pharmacies, hardware stores, garages, pet stores. These stores can stay open, but the others will have to close from the 25th of December to the 11th of January. What's also important to mention in the spring, there were a lot of small shops in Quebec who said, it's not fair. The big box stores like Costco and Walmart don't just sell groceries, they sell all sorts of other products. So that will be prohibited. And that was done in France, actually, a few months ago. So it's going to be prohibited for the big box stores to sell anything other than essential goods. So that will create more of a fair situation for small shops in Quebec. Now, personal care, I know that I'm due for a haircut, but that will be allowed until the 25th of December, but then they will be closed. So barber shops, spas, will be closed from the 25th of December to the 11th of January. So that's a summary of our plan. We believe that it's a plan that gives us every possible chance. Well, first of all, to help employees, workers in health who had a very difficult 10 months, it gives us every chance as well by the 11th of January to break this second wave so that we can start afterwards to really reopen. And it will also allow us at the beginning of 2021 to have some, so that we're not overloading our hospitals. And we know that even in normal times, it's always, the month of January is always a difficult month. So let's do all that we can. So we're in the last sprint. We must redouble our efforts. And I will be like you. We're going to have a wonderful Christmas in 2021. I can guarantee it.
Good evening, everyone. First, the good news. Our vaccination campaign started yesterday. We're seeing the light at the end of the tunnel, but it will be a few months before a majority of Quebecers get vaccinated. But the number of new cases remains high, and some hospitals are at their limit. This is why, after discussing with public health authorities, we've decided to announce a holiday pause until January the 11th. So we're announcing new rules. It will be mandatory to work from home for office workers from December 17 to January 11, except for jobs where attendance is essential. Secondary and primary schools will close from December 17 to January 11, so we've added a week for primary schools. Daycare centers will stay open, but we ask parents to keep children at home as much as possible. Daycare in schools will only be accessible for people working in priority services. Yellow zones will also turn to orange for this time, and orange zones will turn red. We're also announcing more permissive rules for outdoor gatherings. From December 17, we'll allow outdoor activities such as hockey games and ski lessons, but with a maximum of 8 people plus the coach. We'll also open outdoor spaces such as the Jardin Botanique in Montreal, but gatherings in backyards are still prohibited. We're talking about activities for playing and moving outside. Regarding people living alone, we'll allow a person living alone to join one family bubble from December 17 to January 11, but it must only be one family bubble for this period. Regarding non-essential retail businesses, they'll have to close from December 25 to January 11. This means all stores except groceries, pharmacies, hardware stores, garages, and pet shops. And big stores such as Walmart or Costco won't be allowed to sell non-essential products. It's a matter of equity for small businesses. Personal services such as hairdressers will also have to close from December 25 to January 11. So we think that these measures will give us every chances to protect our hospitals and our health workers. We're in the last stretch. We'll have a great 2021 Christmas. Thank you.
Thank you. We'll begin the question period. One question and one follow-up question per reporter. Hello. What proportion of the Quebec economy are you putting on pause, Mr. Premier? And what's the comparison with the confinement in the spring? Is it less restrictive? Well, it's difficult. I don't have the exact numbers in front of me, but we have to take into account an important sector. The construction sector is closed for 2 weeks already, right? So it's not quite the same 2 weeks. It's 2 weeks that end the 3rd of January, but still, they're closed for 2 weeks. We still have the manufacturing sector, so we asked ourselves the question, there's hardly any places in the world where the manufacturing sector is closed. We know that when we close a plant, often it can take a long time to reopen it. And there's a balance to be had there with the economy. So offices, stores, it's a high percentage of the economy, but the manufacturing sector is remaining open. Some people may note a certain contradiction. We're closing shops that are not essential, but we allow outdoor gatherings. They're limited, but how do you explain? And you've also decided to reopen the botanical gardens. That's a demand from the Montreal administration. So why are you allowing that outdoor gatherings? And how come people who live alone can go into another family bubble while closing certain sectors of the economy? And can you also talk to us about the government, which decisions are government decisions and which are public health decisions? I think that we all agree, as I've already said, these are measures that are at least as prudent as what is proposed by public health. Now, we could take your examples one by one. Obviously, outdoors, the risks are not as high as indoors, and that is why some outdoor activities are permitted outside. Well, we have to understand that we have to have a just balance here. The virus is everywhere in Quebec, everywhere, and I think that people have to remember this. It can attack you anywhere. What we're trying to do is to create a certain balance between our measures. We are trying to decrease the probability of contacts from people who don't know each other, but outside, for example, I think is going to be important. The holiday period will be a kind of cocooning period, but with a lot of outdoor activities. That's what we're recommending. And that will allow 8 people, for example, to do an activity together. It's not a number that is huge. We don't want gatherings outside. We are not allowing, for example, to gather outside around a campfire in somebody's backyard because people will go into the home. So we really tried to gain this balance, and we have to look at the impact of this cocooning or the confining on the elderly or on people who are living alone. And by allowing a person who is alone or a single mother to go into a bubble, they are exposed to a quantity of people that is quite low, but it allows them to go through a holiday period where they'll be able to maintain some social relationships, etc. It's the same thing for the elderly. It's a risk. It's a calculated risk. And the sum of the measures, well, we're still recommending that people reduce their contacts. It's not necessary to celebrate more than necessary, but if you do have some activities to do, have them outside. And I think that then the risk is much lower. And we've balanced all of this. And it's clear that when we're at a significant quantity of transmission in the community, there's not really a setting. We're not in a situation where, like at the beginning, in the first wave, where it was healthcare workers and people in the CHSLDs. Now, the virus is everywhere. So it's a systemic approach. We're trying to target settings and take advantage of the Christmas period to add another period where it will have an effect on the decrease in cases, hopefully. Perhaps 2 other points that I want to make. The botanical gardens, To be very transparent, I've been asking for 3 weeks that we open it. So I just got the approval from Public Health. And sometimes it goes in one way and sometimes it goes the other way. When you say permission to single people to go into family bubbles, there's a situation that I thought was difficult was the students who come back home for the holidays. So a student who went to study elsewhere and they come back home, well, I think it's quite normal that we let them come back home, right? Question. I was wondering if your definition of essential products is the same that it was in the spring. So we're talking about winter clothes, a shoe store. Can a shoe store open, for example? Actually, it looks like what we saw in the spring. We will ask people to buy this type of clothing in advance. When we talk about essential services, we're talking about food, we're talking about the drugstore. Otherwise, it's a very complex universe. What's essential? What isn't? What's essential for one is not for others. Hardware stores, for example, they're going to stay open, but it's really, for repairs. But they won't be able to sell, for example, appliances or a coffee machine. I can give you the list because I have it in front of me, but it will be available tomorrow on our website. But it's much more restrictive than during the first wave for the reasons that the Premier explained earlier. Last time the schools were closed, back in March, it was supposed to be closed for 2 weeks, and finally they were closed for much longer than that. So now there's a lot of people, or a lot of parents who are wondering, it's supposed to open on the 11th. Is there a chance that they may open even later than that? I think the risk is very low, and our objective is truly to reopen the schools on the 11th of January. And listen, I've often said this, the last thing we want to close is the schools. Given that the schools are already closing for a certain period of time, there will be some remote learning, there will be some homework given, so the chances are very low. I don't want to, well, children who are listening, you're going to be in school on January 11th. Question? Hello, I wanted to talk about sports. Before the 11th of January, there's very few organized sports, the hockey teams and all of that. Same thing with ski classes. When you say that we can go play outside in a group, are we talking about organized groups, or is it just a bunch of people who decide to go to the rink? We're talking about 8 people plus a coach. So from what I understand, right, when I was young, we divided the rink in half, and we played 2 games, and what I understand is that we'll be able to play 2 games, but in each game there won't be more than 8 players. Plus, I don't know if it's going to be a ref or a coach, but so that's clear. Same thing for ski classes. So ski classes will be able to begin again, but with a maximum of 8 participants plus the monitor. So that's beyond the 11th of January. That's from the 17th of December to the 11th of January. The people living alone who will go into a bubble, are we to understand that it's a one-shot deal? You go once with one bubble, or can we go back more than once but with the same people? You can go back and see the same people. You can't go see your 3 kids and their families. A question? Are you really confident for the shops that there will be a reopening on the 11th of January? Yes, I think that we'll be able to. We're giving ourselves 3 weeks from the 17th of December to the 11th of January. And I'm confident that we'll be able to reopen the 11th of January. And we will give you confirmations, I think the 5th of January, the week before. I'd like to come back to the question of vaccinations. We see that some healthcare workers are hesitant. Does the government have an approach or some kind of program? Because we're in it now, there's some hesitation. There will be more hesitation. Concretely, what are you doing to try to convince people to get vaccinated? I will give you some good news that just came in, actually. I shared them earlier with the Premier. Today, we vaccinated 900 people. So 900 people compared to 300 yesterday. So 900 people on our second day. I want to thank all of the staff that worked incredibly hard. And half of these people are staff. So that's why I said yesterday that we had to wait for a few hours because perhaps there was a surprise effect, people were nervous. Now with the Maimonides in Montreal and yesterday in Quebec, there was no issue at all with the employees. And that's why I think that we have to take a bit of a step back, but I would tell you that having already vaccinated 900 people today compared to 300 yesterday in the same type of setting, that's very good news to me. But clearly, there's going to be an awareness-raising campaign, which is currently being prepared for the vaccination because there are even certain union leaders who have offered their collaboration to work with us. So I think that if we just look at our first 2 days, I'm very encouraged to see what's going on. And that is what allows us, as we often say, to see the light at the end of the tunnel. So let's continue to work, but at the same time, what's happening in vaccination is very encouraging. Question? Concerning big box stores, you said that you want to avoid disloyal competition. What's going to happen in a Costco or in a Walmart? There's going to be barricades or tape. We won't be able to buy anything that's not deemed essential. How will that work? How do we make sure that that's respected? We will make sure that it's respected. There will be some standards, and there could be interventions from the SNS. I think that food and drugs, that's an essential service. Or perhaps other things like toilet paper or whatever, anything. You know, all the places where you can buy furniture and appliances, that will not be accessible. We'll make sure that it doesn't get sold. I want to come back to the personal care services. Now, for dentists, chiropractors, optometrists, are they staying open? Yes, they're staying open because they are healthcare services. When we talk about personal care, we're talking about aesthetics, waxing or massage therapy, but for the others, they remain healthcare services. Question. Mr. Legault, I'd like to come back to the decision to close shops as of the 25th of December. That's in 10 days. So we are getting close to 1,000 hospitalizations. So why did you decide, despite all of this, to wait 10 days, considering that in the hospitals, there's a lot of pressure on the hospitals right now? Well, we announced some measures already in the stores, right? There's a limit in the number of people who can go into a store. People have to wear the mask, and there's monitoring in the stores. Now, there's a question of balance, and I think that there are some families who have young children, and they want to buy presents, and they haven't had time to shop yet. So we want to give them until the 25th, and that is why we started from there, actually. That's why we set the date of the 11th of January. We want the measures to be spread out over 2 weeks, so from the 25th of December to the 11th of January, to accommodate Quebecers. And now the other side of the coin, there's a possibility that these shops will ask for additional financial aid. Is there something coming? Well, the assistance that we had for the rent will remain in place. Now we are talking with the federal government for the payment of salaries. It would seem that one of the 2 weeks should be paid by the federal government, and we're in discussions for the second week. Thank you. Question? Hello. Mr. Legault, you talked quite a bit about Angela Merkel's policies in the past few days. In Germany, social contacts are 5 adults of 2 different households between the 24th and the 26th of December. Why is it different here? Well, listen, first of all, we have discussions with our public health authorities. There are some measures in Germany where we've got the similar measures, and sometimes our measures are not quite the same. Mrs. Merkel, for the time being, has decided to allow visits at Christmas. Germany has been in a difficult situation for the past few weeks, but since March, they've had they've been less impacted than we have. So we have to look at the whole picture. Where are they with their hospitalizations? How many beds do they have available, et cetera, et cetera. So yes, we look at what is being done in Germany, but we also listen to Dr. Arrude. You wanted to broaden the bubble for people who live alone? Yes. In your decision to close shops, non-essential shops as of the 26th of December, the calculations of the revenues of the tax, the sale tax, and did that play a role? No, not at all. One last question in French. Hello.
Bonjour messieurs.
I wanted to know if you evaluated the losses of jobs
and
and losses of shops and manufacturers when you made your decision to close certain stores. Well, we discussed with the federations, with the Minister of the Economy. We took into account the impact if we had closed, for example, the manufacturing sector. But we did not evaluate in a detailed manner. And the first evaluation and the first criteria was truly public health. And I'm proud to say that we respected all of public health's proposals. How will you check to see if stores will not sell non-essential products? Will there be more inspectors? Yes, we've already asked, generally speaking, to have more inspectors from the CNESST, and there will also be increased police presence. So we've asked everybody to keep an eye on these things. We'll go to the English questions.
We'll start with Montréal Gazette.
Bonjour. Premier Legault, I was wondering if you could explain, I understand you're closing non-essential businesses to try to curb the spread, but with the number of daily cases at the level that they're at, could you explain the reasoning behind waiting until the 25th to do so?
Okay. First, we took into consideration the recommendations of public health. Second, I think it's important to say that in retail stores, there were not many eclosions in the last weeks and months, so the situation is not perfect, but we took that into consideration. So we've tried to find a balance, and we've had a lot of discussion with public health. And I think if we compare our measures to what's happening in most places in the world, we're on the side of being more prudent than the average.
And on the same topic, for the non-essential businesses that will be closed down, would curbside pickup still be available at some of these, or are the stores to close completely?
They will be, it will be available. So people who wanted to pick up some goods at the door, they will be able to do so.
Thank you.
We'll go now with CTV.
Oh, it's sanitaire. I just, Mr. Premier, wanted to look at how we got here. So in the span of a month, yes, cases, hospitalizations have gone up quite considerably, but we've gone from talking about having a Christmas break, having a time to be able to gather, and now we've had new retail restrictions, and now we're ultimately shutting down non-essential businesses. Did we get here now because we didn't go further with restrictions in red zones earlier?
Okay, we are in the same situation as everywhere in the world. You've seen last weekend Mrs. Merkel being tougher than she was in the last few weeks. I think that there were some announcements today in London, UK. So adjustment even in Alberta, where they didn't want to put any measures and they had to do so. So the virus has a strong presence in Quebec, stronger than expected a month ago. So we have to adjust the measures like everywhere in the world.
And just my follow-up, sir. We know there has been discrepancies before between what was ultimately done and then what the recommendations were from public health. You've mentioned having these discussions, finding a balance, like Dr. Arrude said earlier as well. Is what we're doing now the ultimately what was recommended, or is this what you think is where did you strike a balance between where public health said we should do and what we're ultimately doing?
Well, I think that we were as prudent as what was recommended, and maybe a bit more regarding retail stores.
Thank you.
We'll switch to now Matt Damour from CBC.
Good evening to you three. The first question I have has to do with the announcements for these 2 weeks of a lockdown. We've heard from epidemiologists and public health officials in the past couple of days who were talking about a 2-week shutdown like you're talking about. And a lot of them said, you know, that's kind of like a circuit breaker shutdown and we need something longer. And we heard 4 weeks, for example. Yeah. Why didn't you go further with this lockdown? Was there a discussion about doing a longer lockdown? And if there was, why not go that far?
Okay, we discussed many scenarios, 1 week, 2 weeks, 3 weeks, 4 weeks. We're coming with maybe average 2.5 weeks. Some businesses will be closed for 2 weeks, some others for 3 weeks. I think that it's enough to curb the pandemic.
So the follow-up is on that question, and I'll open it to the three of you. By January 11th, if we look at the number of cases, and we're still hovering close to where we are now, you know, more than 1,600 cases daily, and we have not curbed the spread, what is the discussion going to look like? Is there going to be a discussion about extending this this shutdown, about expanding it? Where are we thinking about that far?
Well, this is really hypothetical, but I think that we saw, and I take that as a good news, we saw in the last week that even though we went as up to 2,000 cases a few days ago, we have been able to curve it at 1,800, 1,600 in some days. So it's already an encouraging sign, I think, that we can have an impact when we add the measure. And just take the reference of the additional measures that we've put in shopping malls over the last week or so, where we control better the traffic, the flow. So all of those measures, remember, we gave this example of this Swiss cheese slices, that it's not only one measure that works, but it's a combination of measures. So when you add going to teleworking, which is a key measure that we add right now as of December 17, when you remove the schools, which is also a key factor as you had, and when you add those measures in the business and the retails, I think when you add all those measures, I think this is what we hope, that the combination of all those measures will make a big difference, as we've seen in the last few weeks.
And Dr.
And if I may add, the vaccine is coming too.
Yes.
This is one, I would say, l'espoir, the dream of controlling it is there. So even if we cannot vaccinate all the population by January and February, because we will vaccinate probably the persons at higher risk, people at CHSL days, care workers, the impact of the epidemic is going to be different, not killing the same persons, not perhaps getting everybody to the hospital. So that's going to be part of the solution. And, you know, we must always have this balance to make sure that if we are too tough, people will just stop if we stay too tough. So it's why I think the introduction of the vaccine, the analysis we're going to do, we will see what we can be on 11th of January. But I think we could not afford being confined for months because society will and everybody's going to get crazy.
And we'll go with Gloria Enriquez from Global News.
Good evening. I was wondering, how do you see the ski situation working? You're saying that ski hills will remain open, but let's say, can Montrealers head over to a ski hill and rent a hotel and stay there for 3 days? How will that work?
Sure. Well, I think we need, that's the same answer. I think we hope that people can go outside as much as possible. So, and that's the reason we said that you could rent a chalet, or you could go. But I think what we need to make sure that people remember is we need to limit the contacts. That's what is important. So when we suggest those outside activities, which is, I think is a very good news for everybody, but when you go outside, whatever you want to go, walking or skiing, cross-country skiing, whatever you want to do outside, or skating on a rink, let's make sure that you minimize the contact. So we allow people to go skiing, but the same thing, when you do the lineup for skiing, make sure that you keep your distance. So it's all a matter of limiting the contacts. And if we do that, I think that especially outside, people will get this fresh air that we need, but limiting the contact. So that's the principle.
So just to be clear, the hotels will remain open around the
But
ski
the
hills?
hotel have always been open. That's their choice of having this difficult time because they don't have the right level to amortize their fixed costs. But we want to limit those displacement as much as possible.
And
I think the important announcement today regarding skiing is about the lessons. I remember when my two kids were young, it's fun to have them having a lesson and ski ourselves during that time. And many parents told me in the last weeks, we really need to restart those lessons if you want the adults, the parents to ski. So that's why we have an agreement that you can have lessons with no more than 8 people in the lesson.
And what's your reaction to the, go
Yes,
ahead.
I just want to say, but it's not time to 3 families to rent a chalet to be together and be skiing. You can go with your family. If you are going from a red zone to an orange one, you don't go to the restaurant. You're supposed to bring your food, you know. That's exactly what, and I know that people will be attentive to do that, as some of people have been going to Florida or elsewhere. They must remember that if they come back, they will have to be in quarantine, and we will check that. We will work with the feds on this and making sure we don't have the same issue that we had at the spring break in March, if you remember. So I think I am asking people, please, respect the rules. Don't try to deviate it going elsewhere. I think that's very important.
Okay, and what's your reaction to the protests outside?
We continue negotiations at the table, and I think that the negotiations are going well for the working conditions. Of course, we have a disagreement regarding salary increases. We propose about the inflation for the salary increases for the next few years. They would like to have more, so I think Quebecers cannot afford more than the inflation.
Thank you.
Merci, c'est ce qui met fin à la conférence de
For the
presse.
press conference, thank you very much.
Merci beaucoup. Merci tout le monde. Merci beaucoup.